My name is Madison, and I have been living with Lyme for 8 years now. I went to Connecticut when I was 14, and my family lived in a wooded area, but I wasn't looking for ticks. I never saw the rash, the bullseye rash, but not everyone gets the rash. Little did I know, I would start having severe health problems soon after I was bitten. I started to get arthritis in my knees, and I ended up having surgery on them when I was 15, on both of them. And then again when I was 18, they broke my tibia and did a tibial tubercle transfer on my knees. Those are some of the more severe surgical issues, but I also developed cyclical vomiting syndrome, which I've never heard of before in my life, but now I know the culprit, which is the Lyme. Currently, I am not going to school. I've been going to school full time since I got out of high school, except for when I had to take a break due to my knee surgeries, and I also had a baby boy, and I took about a year off for that, and ever since then I've been a full-time student studying dietetics, and I had to withdraw because I couldn't walk to class anymore. I could not study. I could not read and focus to save my life. It was very difficult to write papers because I couldn't form sentences the way that I had done in the past. And then the pain in my joints all throughout my body got so severe that I had to go on morphine, and that rendered me unable to drive. So I can't drive. I can't really walk around too much. I can't even sit down on a couch comfortably because the pain is so bad. Even with the morphine, I'm in pain all the time. It just depends on how excruciating it is as to how I'm feeling that day. I've also been having some more issues with my stomach and vomiting, and I can't keep down all of these medications. Oh wait, hold on. There's more. Okay. I can't keep down all of these medications for my Lyme and my co-infection, Babesia. And they just told me, my immunologist just informed me, that I have H. pylori, which is the cause of stomach ulcers and other stomach problems, because the bacteria are actually really intelligent and they bury into your mucosal lining. It's not fun. It's not fun at all. But to cure the H. pylori, you have to do a 2-step antibiotic procedure. But I can't keep antibiotics down orally. I can only handle them if they're IV. And I'm getting 2 IV Rocephin infusions every week. And we're discussing IVIG immunotherapy as well, because Lyme disease attacks many of your organ systems, but it also is an autoimmune disease. Your immune system is severely damaged, and then when you pump your body full of antibiotics, the antibiotics also hurts your immune system. And they believe that I already had some type of autoimmune disorder, which is another reason why I might receive the IVIG therapy, which is very expensive because they have to go through thousands of people's globulins in their plasma and retract them, separate them, test them for up to 3 years. They undergo rigorous testing before it's injected into you in a 5-hour infusion process. It's very expensive, but if you have Lyme disease, you know that it's an expensive disease. I'm so lucky to have insurance, and honestly, I can't imagine what I would be doing right now if I didn't have insurance. I mean, all these medications. I mean, the Pepto's not expensive. No, that one's not expensive, but that's what my immunologist told me to do to line my stomach so I stop throwing up all the time. These natural ones that I got from my Lyme literate doctor are very expensive. This one is for babesia, immune powder, the morphine, these natural little bottles were a few $100s for maybe 7 medicines. There's a lot that insurance doesn't cover, and if you don't have any insurance, then you can't really get help at all. Having Lyme disease is undescribable. I struggle sometimes explaining it to people because it's very complex. It's very dynamic in how it attacks your body, and it's nearly as resistant as we are, the Lyme warriors, but we're more resistant. We will keep fighting, and I will keep fighting, one day at a time. Some days are harder than others. I have a 3-year-old son, and he was tested for Lyme, and thank you God, he came back with a negative result for Lyme. And I broke down crying on the phone as soon as they told me, because it was such a stressor to me since I found out that I had Lyme, because it can be passed through the placenta to the fetus and can abort the pregnancy. It can cause long-term damage to the child. I mean, it's serious stuff. Lyme disease is a nasty, nasty bacteria. The Borrelia burgdorferi bacteria is nasty, and that's the bacteria that causes the Lyme disease. And it drills into all your tissues. And these are some of my symptoms: joint pain, nausea, vomiting, insomnia, confusion, numbness, loss of libido. I'm 21. I mean, it affects every system in your body. Intense stomach pain. I had to go to the emergency room because my stomach was hurting so bad. And they gave me pain medicine and sent me on my way. You know, it's very difficult to attack the root cause of this disease because it hides from your immune system. It hides from antibiotics. It hides from everything your body has to throw at it. And so we're stuck taking these medicines that make us even sicker and weaker from herxing, and then herxing from the IV antibiotics. It's a struggle, and I wouldn't wish this on anyone. But this is important to get the word out and to spread Lyme disease awareness, because people need to know, people need to protect themselves, and people need to get early diagnosis. There needs to be better treatment protocols. There needs to be a lot of work done when it comes to Lyme disease. It will save lives. It will save quality of life. And that's all we're looking for. We just want our lives back.